So the first step is to review your physician's orders and compare it to the MAR, or the medication report that's in the patient's chart. So first of all, let's see who the patient is. Jack Buzzard, MRN 87 13 46 51. Date of birth 6/20/1998. And looking at the medication record, Jack Buzzard 87 13 46 51, 6/20/1998. So we have the right patient. Now let's see. The doctor ordered all three medications for 8:30, and we have cefaclor 500 milligrams by mouth every 4 hours, synthroid 100 micrograms by mouth every morning, and nitrobid 2% topical ointment every morning, 1 inch on the patient's chest. In the medication report, it has all three of them to be administered at 8:30 as well. And we have cefaclor 500 milligrams by mouth Q4 hours, synthroid 100 micrograms by mouth every morning, nitrobid 2% topical ointment every morning, 1 inch on patient's chest as well. Okay, so great. Doctor's orders match up with whatever is, or with what's in the medication record. So medication reconciliation has been performed. So I'm not really going to need these doctor's orders from now on. So I'm going to set these aside now. But I will be using the medication record here for the rest of this video. So now that I know what I'm going to need and what I'm going to do, I'm going to go into the medication room. I'm going to wash my hands. And then I am going to pull my meds and gather any supplies I need. And as I pull my meds from the Pyxis, I'll be doing the first medication check, which is I'll be checking for the 6 medication rights, which are the right patient, the right route, the right dose, the right time, and the right medication, and the proper documentation at the end as well. Okay, so first check, we have cefaclor 500 milligrams by mouth every 4 hours. So we have a oral suspension for, this is indeed cefaclor. That's great. And unfortunately, my unit only has it in 250 milligrams per 5 mLs. But for that, I'll do a drug calculation here in a bit. But so far, this is the right med. And once I'm in the room, I'll be making sure it's for the right patient as well. Now next up, we have synthroid 100 micrograms. Let's pull our med. This is indeed synthroid 100 micrograms by mouth. Of course, it's a pill. Also, make sure that your meds aren't expired. I mean, if you don't eat expired food, why would you take expired meds, right? Okay, so our synthroid is good. Next up, the doctor has prescribed nitrobid 2% topical ointment. And here we have our nitrobid 2% topical ointment. Okay, so first medication check has been done. Now what I'm going to do next is I'm going to grab my nursing drug reference book, and I will be just quickly reviewing the meds I'm about to give. So first up, we have cefaclor. Here we go. Cefaclor. Action inhibits bacterial cell wall synthesis. So this will be an antibiotic. Now we will also check the dose. For adults, the dosage and route is by mouth, 250 to 500 milligrams every 8 hours, or a maximum of 1.5 grams a day. 1.5 grams ends up being 1,500 milligrams. So if the doctor ordered 500 milligrams every 8 hours, that would be basically passing that max. But in this case, or any other case, I would call a doctor to make sure, hey, is this what you want? But sometimes they may have a good reason. So let's just assume that for this checkoff, the doctor has a good reason. So I'm going to go through, after checking with the doctor and him telling me he has a good reason, I'm going to go through with the order, and I will move on to its side effects. So the side effects for cefaclor are dizziness, headache, seizures. Or seizures is a more, a more risky one, but the common ones are dizziness, headache, diarrhea, nausea, vomiting, rash. All right. So then next we will look up levothyroxine. Here we go. Levothyroxine. Uses for hypothyroidism, thyroid hormone replacement. Okay, so this is a thyroid medication. And the dosage and route is PO, which we have. For adults under 50, I'm going to assume my patient is under 50 because it says 1998. The dosage is 1.6 micrograms per kilogram per day. So in this case, since the patient's weight is not in the chart or on the record, I would weigh them and just make sure that the dosage is right. But we're going to assume that that's been done and that it's good, at least for this case. So side effects include anxiety, insomnia, tremors, headache, tachycardia, nausea, diarrhea, cramps. All right. And lastly, we're going to go over our nitroglycerin. I love these because it tells you how to pronounce it as well. Okay, so glycerin, sorry. Okay, so the dosage for the topical administration is 1 to 2 inches every 8 hours. You can increase to 4 inches every 4 hours PRN. Thankfully, this has just been prescribed 1 inch every morning. And this is for chronic stable angina pectoris, prophylaxis of angina pain. So it decreases preload and afterload. And the side effects that may occur are headache, dizziness, hypotension, tachycardia, nausea, vomiting, sweating. All right. So now that I know what side effects, what reactions to look for, now that I made sure that the dosages are right and safe for my patient, I'm going to prepare my meds, but I'm also going to do my second medication check. So, let's see. I'm going to pour up my cefaclor first, and I'm going to grab more supplies as well. I'm going to grab my cups. So, since cefaclor asks for 250, or since the order asks for 500 milligrams, but the unit only has 250 milligrams per 5 ml, bottles, then if the doctor ordered 500 milligrams, you simply multiply what the unit dosage has, which is 250 times 2. You multiply 5 mLs by 2, which in turn you would be pouring 10 mLs for this patient. And if you need a calculator, you can write down the math, do the math on a sticky note on your phone, but just make sure you're giving the patient the right amount. So now, as I'm going to measure this up, like I said, we're going to make sure this is indeed cefaclor. This is PO, so second check is good. When you pour it out, make sure you get down to eye level. It's very important. Okay, and now that I'm down to eye level, I made sure indeed that the amount I poured is indeed 10 mLs, and I will set that aside. Okay, next medication. Second check for Synthroid. 100 micrograms PO. 100 micrograms PO. Okay, we are going to, and when you do this, make sure you don't touch it. Same thing for the liquid. Just let it fall into the cup. There you go. All right. And now, lastly, I'm not going to prepare this right now because you don't want to walk around with a patch and exposed ointment, get it on you, anybody else, or anything. But I'm going to do my second check right now. We have NitroBid ointment, 2%. So far, first two checks for all three meds have been done. I'm going to also grab my patch for the NitroBid. I'm going to take that with me as well. Alright, so now that I have all my materials, all my meds, all my supplies, I'm going to grab everything. I'm going to walk over to the patient's room. Knock, knock. He says, come in. And then I introduce myself. Hey, I'm Chris. How are you? I'm going to be your nurse today, and I'm here to do a procedure on you. Or not a procedure, but I'm here to give you your meds. But first of all, can you tell me your name and date of birth? And as he tells me his name and date of birth, I will be reading his armband and make sure that everything he says matches up. So now that I know this is Jack Buzzard, born on 6/20/1998, I will make sure the door is closed for privacy, move that curtain in case he's sharing the room, lift up that bed, wash my hands, perform hand hygiene for 30 seconds, lower down that handrail, and then proceed to explain. So what I'm going to do is give you your meds, like I said, and first I need to know if you have any allergies. No? Okay, that's great. Always check if they have allergies. Make sure to ask, because even though on the MAR it says they don't, you never know. So just make sure. But okay, so he said no allergies. Can you swallow? Make sure to assess if they can swallow. He said yes, great, because you will be having to swallow 2 of these meds. And so now that that's out of the way, I'm gonna put on my gloves. Although I don't want to, I feel bad wasting gloves, so we're just gonna say I put them on. I'm gonna put on my gloves, and then I'm gonna hand him his first medication. And so this is where you do the third check. And also, you do, the most important check, that it's the right patient. So as I'm about to give him the first medication, I'm going to make sure this is indeed cefaclor. I indeed make sure I poured out and calculated the right dose. Of course, it is, right now is the administration time that the doctor ordered, so the time will be right on all of these. And this is indeed Jack Buzzard. I can even have him repeat to me his name one more time. And so here you go, Mr. Buzzard. If you need to sit up, let me know. I'll help him sit up. I'll raise the head of the bed a little so he can sit up. Pass him his med. There you go. Have him swallow it. Here's a little bit of water for you. Wash down that nasty taste. I know it doesn't, taste great. And of course, I would have let him know that this is his antibiotic. And now we're going to move on to your next medication, Synthroid. It is your thyroid medication. It's a pill, so you're just going to go ahead and take that. Here's some water so you can wash that down as well. All right, great, good deal. And now, lastly, I'm going to administer the NitroBid. Now, for the NitroBid, I'm going to first ask him, do you have a patch on right now? And let's say he has one on the left side of his chest. So what I will do is I'm going to, put on a new pair of gloves. And then I'm going to remove the patch, wipe down where the patch was, make sure you get all that off. And then when you have the patch, have it folded up in your glove And whatever you use to wipe them, same thing as well. Ball it up in your glove. Don't let it touch anything else. What you're gonna want to do is you grab the palm of your glove and then you just pull it out. Same way as whenever you're dressing out of, contact precautions. Pull it out. Hold that dirty glove in your last gloved hand. Grab the cuff. Pull it out as well, and throw it in the trash. Or in this case, for the nitroglycerin, you would throw that in the biohazard. But yeah, make sure as you take that off, it doesn't touch anything. You take off your gloves the way you would using standard precautions. And now, what you want to do next is you're going to want to wash your hands. Make sure you wash your hands. Do hand hygiene for 30 seconds. Put on a new pair of gloves. And then you're going to label, you're going to label the new patch with the date, time, and who gave it. And so, now that that's done, Mr. Buzzard, now the last med I'm going to give you is your nitroglycerin. And this is for your chronic Almaguer-Torres. Now, we're going to do our last check on this one, of course. Super important because this is, an even more dangerous drug. So we have nitroglycerin, or glycerin, 2%, topical ointment, once every morning. That's good. We're about to pour out 1 inch. We have the right patient, okay? So, like I said, my gloves, I washed my hands, my gloves are already on. I'm going to measure out just one line and measure out 1 inch as it says in the MAR. I would pour it out, but this is toothpaste, so I don't want to waste that. So I poured out my 1 inch of nitroglycerin, and then I will apply it. Since he had the other patch on the left side, I'm going to apply it on the right side on a non-hairy area on his chest, and I'm just going to tape it on, and then quickly dispose of my gloves and make sure I wash my hands right away. Another 30 seconds. All right. So now that that's been performed, I will lower his bed, put up his handrail. I would let him know, all right, Mr. Buzzard, I'm going to wait here a few minutes to see if you have any adverse reaction to the nitroglycerin especially. And as I do that, or after I tell him that, I will be documenting, which is, the sixth right to all this documentation. I will be documenting what I gave, the dose, to who, what time, the route, the medications, of course. And, after a few minutes have passed and he's okay, I will hand him my call light. I will let him know, hey, I'll be back in 30 minutes then. If you need anything before then, let me know, hit that call light. And then as I walk out, I'm going to perform hand hygiene one more time. And like I said, I've already documented, make sure my documentation is right. And so that part of this video is done. But I will keep on explaining what you would do for other forms of administration. So, for example, if you have, say, a sublingual or a buccal medication to administer, it's important you instruct the patient not to chew on it, not to swallow it, not to drink anything with it. You have to let it dissolve. If it's under your tongue or in your cheek. Let it dissolve completely. Once they said it has, just make sure, have them open their mouth, take a look inside. If it's eye drops or eye ointment, what you want to do is you want to hold a cotton ball or a piece of tissue right there under their eye. And for all of these, you would, of course, wash your hands before and put on some gloves. But like I was saying, and then you will hold the eye drops and let the drops fall into the conjunctival, sorry, I can't pronounce it right now, sac right above it. Let it fall in there. You administer however many drops the doctor prescribed, and then if they prescribe for the other eye, do that eye as well. Tell them after you put in the drops, to gently close their eyes, keep them closed for a few minutes, and yeah, or if it's an eye ointment, then pull down the lower lid of their eye and just apply the ointment. You can even give them an eye patch if they, if you have to, have them maintain their eyes closed for a few minutes as well to make sure it absorbs. Now, if you have to give nasal drops, what you want to do is have the patient breathe through their nose. And when you give eye drops, also remember to gently hold the nasal cavity when you administer it. But back to the nose drops. If you give nose drops, have them breathe through their nose, and then you're gonna put in the drops through each nares or one nares, depending on what the order is, and you're gonna have them hold their head back, have them tilted like that for a few minutes as well to make sure it's absorbed. Now, the only other form of administration that there is would be also ear drops. If you give them ear drops, have them lay on their side. You pull the pinna or the earlobe appropriately, and then you administer however many drops the doctor prescribed. Have them lay there for like a good 5 minutes to make sure it goes in. If you got to do the other ear, you can do it after the 5 minutes. And lastly, if you have to give an enema, which is the most tedious, what you want to do is you want to gather all your supplies first, because this one is a bit more lengthy, and then you're gonna explain to the patient what you're about to do, because it's kind of invasive, a little invasive, and so you're gonna have them lay down, for example, on their left side. Make sure you place a waterproof pad or a chuck under, because things might get messy. Make sure you have a bedpan or a bedside commode, or make sure the restroom's nearby and easy to access in case they need it. So you're gonna have them lay on their, for example, if you have them lay on their left side, you would have them lay on their left side, have them bring up their right knee. Of course, you're gonna wash your hands before this. Make sure you have gloves on when you're about to prepare the things, such as, or what I mean is the commercial enema bottle. You make sure you have your lube. You want to lube up the first 3 to 4 inches, and then once you have that ready, you would, of course, spread the buttocks, and then slowly and gently insert the enema up the anal cavity, about 3 to 4 inches deep. You help them through it, have them breathe in and out, relax, and then just gently squeeze the enema to empty the contents of it into the patient's cavity. And so once you've squeezed all the solution, you take it out, and then grab a nearby towel. Make sure you have a towel or anything to clean it up, because you never know what might come out of there. And then just dispose of it in the biohazard bag, because it was inside of them. And so instruct the patient to lay there. They might feel the urge to have to use the restroom, specifically for a bowel movement, right away, but tell them to please hold it as long as they can. These things usually take 5 to 15 minutes to kick in. But once they really, really have to go, just have them use the bedpan, bedside commode, whatever is best for them, and instruct them not to flush it. If they feel that it's the solution they've expelled, just instruct them to leave it there, so I can come back and check on it before it's flushed. And of course, you would dispose of your gloves and wash your hands to give any perineal care if you have to. But yeah, that's pretty much all the ways you would administer medications.